Good morning. My name is KT Gallagher and I am the Dunn County Health Department Director. And when I put out the media alert to have a conversation through Facebook Live and with our media partners yesterday morning, I really wanted to reiterate some of the good information that is out there from our partners with a Dunn County face. But due to the quickly changing informational environment, things are changing so fast that this is actually more of an update to tell you about COVID-19 here in Dunn County. I want to set up how we're going to work today. We are broadcasting through Facebook Live. Technology is fantastic and we appreciate the IT professionals and the media folks that are here today, all spaced beautifully, 6 feet or more. We are going to open up for some questions after the update for folks in the room, as well as a couple Facebook Live questions as well. We'll try to get those answered. And then we will follow up. At this time, we don't have plans to do this on a more regular basis, but we will change that as demand increases. We really are trying to get you the best information as timely as possible, and sometimes that can be a challenge when things are moving as quickly as they are here. So let me start by saying we do have a positive COVID-19 case here in Dunn County. We were notified of that about 3:30 yesterday. It was incredibly important to me that we shared what we knew just as quickly as we could. And so sharing that via press release within an hour of notification from the state was important. This is our first and only case that we know of to date. However, we do continue to test folks. To start things off, I want everybody to know that privacy is important. People's medical history is their own. And so for today, I am not going to share anything that can help identify this individual in a way that would compromise that privacy. And I appreciate you guys understanding that. So what we know is that we have an individual that resides in Dunn County that tested positive for COVID-19 after significant travel, both abroad and in the United States, to areas that we know have community spread. This individual is complying with our orders to self-quarantine. They are helping us connect with all of their contacts so that we can notify them and talk to them directly on how they can self-isolate and self-monitor, so that they can keep themselves and their community safe. That's what we know. In general, I want to talk a little bit about COVID-19 here in Dunn County. People are at low risk for COVID-19. Because of how it spreads and because of the numbers, people continue to be at low risk. And I think that that's important to really hold on to. In Wisconsin, we have, and I realize that the data this morning is quickly outdated, but as of 8 o'clock this morning, we had 155 cases on the Wisconsin DHS website. That count did not include my Dunn County case. It did not include the Chippewa case, the Eau Claire case. So we know that that is just changing so very quickly. And I expect that we'll see a different total today when they update at 2 o'clock. We know that in addition to that 155 cases, we experienced our first deaths in the state of Wisconsin yesterday. The governor's office put out a press release that we unfortunately had lost 2 people to COVID-19. I think that's an indication that this is serious. We want to prepare, not panic, but take it seriously. And do what we can, not only for ourselves and our loved ones, but for our whole community. When I talk about how fast the information is changing here, I think that it's important to note that right now there is guidance from the state, a moratorium or a prohibition on having gatherings of more than 10 people. And even if it's less than 10 people, we're asking for 6 feet of separation. And that strict separation is helping us really prevent that transmission from folks that may not know they're sick, either because they are asymptomatic or not showing any symptoms, or from folks that have such mild symptoms that without a real good check-in with their own body, they might not recognize that that shortness of breath, that minor sore throat, headache, low-grade fever, 100.4, is really indicative of something more than normal seasonal allergies, the beginning of a cold or the flu. So it's really important that we maintain social distancing and follow that prohibition on mass gatherings. Because again, even if you're a healthy adult with no underlying health issues, if you were to become sick, that there is that possibility to share that germ with other folks that might not have the same outcome for you. So it's really important for social distancing. Another thing that I need to share is that there has been a decrease in how dense childcares can operate at. So we are asking that childcares have no more than 10 employees and no more than 50 kiddos. We're also asking folks that if they can keep their kids at home, they do that. And so what that does is it frees up those spaces in childcares for our critical infrastructure, our first responders, our healthcare professionals that we need to be at work. They need childcare. Please consider keeping your kids home. Also, there has been some updates to how the state is prioritizing testing. So we're really asking folks to be good stewards of the resources that we have. The state lab is testing folks that have been hospitalized with an exposure, so really sick, or medical professionals, so that we can use those resources really well as first and second tier prioritization. Other folks that either don't have a known exposure or travel history or are not really ill are being placed on that level 3 or level 4, and it may take longer to get that testing completed. In addition to our state lab and the City of Milwaukee lab, we also have private labs that are coming on to increase capacity around testing. So our partners here in the Dunn County area at Marshfield, Mayo, and Prevea all have capacity through private labs to do some testing. And we are seeing testing come through from Mayo and Rochester and Prevea using a contract as well. So I think that's important as far as knowing what's going on with testing and prioritizing the testing. To be clear, we really want to prioritize that resource, and we are asking folks that if they don't have symptoms, or if their symptoms are mild, that they call their provider and they stay home. You can self-isolate or self-quarantine without a test. Leave the test for folks that we really need to have tested. I'm also going to ask that you ensure that we are prioritizing the safety of our healthcare providers. If you're not feeling well, call your provider. Use telehealth. Call the nurse's line. Please refrain from walking into the emergency department for mild or asymptomatic illness. We want to make sure that you're not exposed to somebody who's really sick, and we want to make sure that we're prioritizing that resource for folks that really are. And then I know everybody has heard about flattening the curve. It's so important that we do our part for the community, that we make sure that we prevent or delay any kind of transmission, if at all possible. And so what we expect is that, and really how that works, is that if you've got about 20% or less of the population that gets sick with COVID-19, and they all get sick in the same 2-week period, that's really going to overwhelm our health system. But if we can flatten the curve by expanding how long it takes people to get sick, then we can stay under the threshold at which our health system providers and partners can manage those folks with increased symptoms or advanced illness, thereby keeping more of us safe and healthy. The ways you can help keep our Dunn County community safe are the things that you already know to do during cold and flu season. We want to make sure you're washing your hands. Wash your hands with soap even. Make sure that you are using hand sanitizer if you have to touch your face. Try not to touch your face. It's really hard, but do try. We ask folks to use good respiratory hygiene. We are ingrained to cover our cough with our hand. That takes the germs from your cough and puts it on your hand, and then puts it on all of the things that you touch. We really want to make sure that people are covering their cough with their elbow. And so that takes their germs away from where they're touching, and again, helps flatten the curve, helps prevent transmission. And then we really want people to stay home. Social distancing will help. It will help make it so that folks that are at risk for adverse or increased morbidity or mortality, meaning they have things that make them more susceptible, like being 60 or better, having underlying health issues like diabetes or lung or heart disease. It will keep them healthier, our community healthier. And additionally, it will make it so that we stay healthier. So when you think about social distancing, I ask employers to really consider who has to be there. If folks can work from home, let them work from home. If folks have an underlying health issue or report that they have symptoms of illness, ask them to go home. Don't put unnecessary barriers on social distancing. Additionally, we want to make sure that folks that are returning from areas with community spread do their part. They stay home, so that when they return from places like Seattle or New York with identified community spread, if they don't know they're sick, or if they're asymptomatic, they keep those germs to themselves. And that's really important. Stay home when you're sick. I know that Dunn County residents are incredibly hardworking, and it's easy to push through when you don't feel quite right. Again, mild symptoms, low-grade fever, a little shortness of breath, a sore throat. But right now, I need you to stay home. And then finally, I want folks to be kind. To be kind to yourself, to be kind to others. This is stressful. The unknown is stressful. Give yourself a break from constantly monitoring the news and being COVID-19 all the time. Do the things that you know recharge you. Take a walk outside, even in the snow. Pet your dog. Read a good book. Pray or meditate. Things you know work. Continue to look for ways to do them while social distancing, maybe through the magic of the internet, stream group fitness or a yoga class. I think those are great options. Continue to recharge your own batteries. And I would ask you to be kind, because people are going through incredible hardships right now. With the prohibition on mass gatherings of more than 10 people, that's particularly impacting our businesses here in Dunn County. Be kind. Consider supporting our businesses by doing curbside to go, or going to their online business and ordering a couple things. Or for the folks that have had their hours cut or their jobs, really considering doing your part to support some of our charitable organizations here in Dunn County, like Stepping Stones, so that we can make sure that our most vulnerable, folks that are food insecure, homeless, or don't have a medical home, have the support they need in this really tough time. Thank you for your time today. I appreciate it. At this time, I will open it up to see if there's any questions in the room.
Was this person, did they have mild symptoms or more severe?
So luckily for this person, they did have mild symptoms.
And when did they get tested?
So the testing was completed on the 17th. And so that's really consistent with what we're expecting from our lab partners, that within 24 to 48 hours of them receiving the sample, they're often able to process it. Through the state lab, based on that tiered system, it may take longer than that.
Have the individuals that have come in close contact with this individual been tested, and when might we get back results to know if there's community spread?
Thank you for the question. So I'm going to summarize that so that everybody can follow along, just in case it was hard to hear. So you asked that when will everybody that came in contact with this individual be contacted by the health department, and when will we have a better idea when and if they're tested, and when and if we have community spread, correct?
Yes.
Fantastic. So case contact and contact tracing is what public health does. We do it in the background every day. Typically, it's for less exciting things like E. coli and STIs, but that is really our job, and we are good at it. So we started yesterday. So we got the call at 3:30. We had a conversation within just a couple minutes. And then we're already starting to develop that line list so public health can reach out and say, we need to talk to you about this, and we need you to stay home. So we are doing that work right now. We're going to have it done just as soon as we can. And we are bringing more people on to increase capacity around that. So really looking at prioritizing testing, it's hard to say who's going to be tested and when. It's hard to say when we're going to get that back, especially if they are asymptomatic and don't meet that prioritized testing criteria. But again, the one thing that we know is that this is subject to change. Right now, there are very few counties in Wisconsin that have community spread. And if we all do our part and stay home, practice good hand hygiene, good respiratory hygiene, stay home when we're sick, most especially, then hopefully we can get out in front of this.
How many tests have you done, Dunn County? And then follow up, how many have you received back?
Sure. So this is also something that changes regularly. I did not have an opportunity to check this morning, so the state updates that for us daily. I know that we have about 20. I know that we have some outstanding, and we will continue to have some outstanding, just as more people are tested. It's constantly evolving. All right, so at this time, are there any other questions in the room? Good. Are there any questions on Facebook? Wonderful. All right, thank you guys very much for joining us. I would encourage you to use primary sources of information for answering questions like the Wisconsin Department of Health Services COVID-19 page, as well as the CDC's COVID-19 page. If you can't find the answers to your questions after that, we are your health department. Give us a call. You can reach us at 715-232-2388. Thank you, and stay healthy.